Goshen is a hidden gem. You would not expect the level of care in a small hospital like this that you actually get. The staff is first class. The facility is first class. The technology is first class. The leadership is first class. My name is Dr. Peter Delnicki. I'm a retired obstetrician and gynecologist. I was with Goshen Health OBGYN for a period of about 14 years. Currently, I live in Bradenton, Florida. I have a very strong family history of prostate cancer, so I've been monitoring myself very closely from my late 40s on. When my PSA levels started to rise, I went to my friend, Dr. Baldwin. He did the biopsy. It did confirm that I did have prostate cancer. 3 of our kids live in Chicago. They wanted me to go to University of Chicago or Northwestern, or maybe even go to Sloan Kettering or Mayo Clinic or Cleveland Clinic. I assured them that I was perfectly confident with the care that I was going to get at Goshen Hospital. During my course of my practice, I had been affiliated with University of Chicago, with Northwestern, with Rush, with Loyola, so I was aware of what was going on in each one of those centers. Big institutions have a reputation, but they have numbers. And when you go there, you become a number. You become a diagnosis. I was aware of the approach that Goshen Hospital had to each individual patient, and that's the kind of care that I was seeking and wanted to have. Dr. Vegeffi, I have known since my practice here. I had a frank discussion with him about whether the facility would limit the quality of care that I got, and he reassured me that what Goshen has to offer is cutting edge. The Ethos machine that they offer will give me the best care possible. The Ethos machine is a very meticulous, calculated approach that takes precise measurements to avoid any injury to adjacent structures. It will limit the possible complications and side effects that exist with radiation therapy. I feel guilty calling it a treatment because there's very little to it. They do a scan on me initially to make sure that everything is where it should be, how it should be, and I have the treatment, which lasts all of 10 minutes, and I'm done. I feel nothing. I have no pain. I have no discomfort. I feel the same now, a week and a half into it, that I did when I started. Both my doctors and friends that have had similar procedures done suggested it's very important to maintain my stamina, and that the radiation will at one point fatigue me. So I'm trying to build up stamina while I still can. So how you doing today?
I'm feeling wonderful.
Good. Radiation side effects, anything that's different for you today?
No, that's knock wood. Nothing's going wrong so far.
Excellent. Good to hear that.
There's a couple of rituals that I've had. These are all my name tags that they give me every day when I'm going in for treatment. This is my schedule that I scratch off the day. I've had 38 treatments. 39th one is today, and I'm done. This is my youngest daughter, Claire. She's my inspiration. Well, we're walking over the hospital for my last treatment. I had expectations of having some kind of limitation at some point during the treatment, some discomfort. I was worried about taking the trip back home by car. We made contingency plans for me to fly back, and that was changed because I feel no different. I feel great. Well, as soon as we're all done, the car is packed, and we're going to head off to Florida, back home. You have certain expectations as having been a staff member and having friends taking care of you, that you are going to be getting preferential treatment. And I felt like I was getting preferential treatment, but I noticed that everybody was.
Are you excited to be done?
Absolutely. Everybody was being treated like a VIP. Everybody was, the personal touch was there. They went out of their way to be cordial and provide comprehensive, compassionate care to everybody. I was just overwhelmed with the care.
If Dr. Vegeffi sees you back there, you'll be good to go.
All right.
I know this is your last day of your treatment. We can talk a little bit about follow-up. you've done so well during the course of your treatment. I think it's fair to say that your quality of life wasn't affected that much. Is that true?
Absolutely.
Okay, wonderful.
All right. If you want me to compare Goshen to a big hospital, it would be like staying with a friend versus going to a hotel. It's personalized, it's friendly, it's homey. You get the sense that people actually are looking after you and not looking at your disease.
See you. Take care. Bye.
Yeah, sure. The care that you get here is second to none. And I say that without hesitation.